Hello, welcome to your beginning course, really, in the Introduction to Psychology. I am recording this, but if you were to use this on your own, you could almost use it as an interactive type of situation. So, Introduction to Psychology is broken up into Unit 1 and Unit 2. I'm going to record all of this, but I suggest that at the end of Unit 1, you stop and wait. So, if you were to do this on your own, you would just go to the hyperlink and click What is Psychology? And that will bring you to this page. What is psychology? Well, according to the APA, which is the American Psychological Association, psychology is a study of the mind, how it works, and how it affects behavior. It is both a medical and behavioral science and a social science. So it's a little complex because sometimes it's more about our thoughts and feelings, and sometimes it's all about biology. Psychology begins with the scientific method using observation and research, but it also calls for an understanding of human behavior that goes beyond science alone, meaning you can understand someone who is diagnosed with ADHD, attention deficit hyperactivity disorder. But you also need to understand their environment, where they live, who they live with, who they interact with, other things going on, even their diet, behaviors. It's all encompassing. So, psychology is complex in that you have to understand that the first step is usually to look to the science, but you must include the entire person in your analysis. So, to wrap it up, what is psychology? The science of behavior and mental process, as always, and it's based on theories and studies and clinical trials that are proved or disproved. And the theories we use today have gone through thousands and thousands of clinical trials in order to be approved theories that we made into approaches to help people. There are many approaches, and you have to find the one that fits the problem and the client, and that will be part of your second unit. Remember, observation must be part of psychology, otherwise, it's not science. And when I talk about the early psychologists in the next unit, you'll see they're sort of missing this part here. It's not measurable. If you can't measure something, you can't get data. Without data, you really can't prove anything. And even though that sounds scientific, it does apply to psychology in many ways. For example, sorry, trying to figure. How we feel often shows up more in how we act. Sometimes we don't even know something isn't right until we find ourselves acting differently than usual. And that is usually when we seek help, because our behaviors are not what they usually are. And then you find out that there's more to it. So let's begin. What is psychology? We're going to talk about the first two paradigms of psychology. Paradigm is a word for umbrella term for sort of a group. So, what is research psychology will come first. This is funny. If you don't know what it means now, you'll know it soon. So, research psychology. Research psychologists work in labs and universities, and they study the reasons for psychological issues. This is where it all begins. They discover who is suffering from issues, possible connections, meaning correlations, and sometimes causes, which is called causation, for disorders and different approaches that might help. They research studies, they conduct clinical trials, and this goes on for a long time before approving a treatment. There's a lot of experimentation. What you will find is in the history of psychology, this area with experimentation is really sort of shameful in some ways that are now illegal. Some of the experiments you'll see seem very inhumane and cruel, and they are no longer allowed today since the ethics criteria was added to the American Psychological Association in 1973, I believe. But we did learn a lot from those experiments, and we'll actually see some of them as well. But if you're interested in psychology, but you're not one of those people person kind of people, if you like helping people and you like psychology and you like research, this could be the area for you. Maybe the one on one interaction with people isn't what you're looking for, but you're fascinated by the field of psychology and what makes people do what they do and how to help people who are suffering from different types of emotional and mental disorders. So it could be something that's interesting for you. And also, there's actually more room in this field since most people want to be an applied psychologist, the more traditional type. They don't want to be removed from the people they're helping. So, if you like research and you like people, this might be an area to think about. So, what's the difference between research and applied psychology? Research psychology looks for origins of something, the causes of something, and the results of certain types of behavior. So, but how is this done in real life example? Let's look further. This font is so small, I apologize. So, examples of how research psychology works. Origins is where does it come from? Why is this patient experiencing this? Causes. Did something trigger it? Is at a certain age where hormones would cause a genetic predisposition for perhaps schizophrenia or depression? All of a sudden, start a problem that didn't seem to exist before, but was probably inherently genetic? When was it first noticed? A lot of these things can help you figure out the causes. And results. How is this impacting someone's life? What is it doing to make them have maladaptive behavior? And how can we treat it? So, where does it come from? Why is it happening? What caused it? And observe what's going on so we can treat it. For example, is this a genetic issue? Have other family members shown characteristics of this? Are there environmental aspects to it? These are questions a research psychologist would ask in terms of looking for the origins of a psychological disorder or mental health disorder. Here are some examples that would help you understand. Schizophrenia and depression are often genetic. They run in families. Clusters of this appear in generations of families. It doesn't mean you're destined, though, to have one of these disorders if it does appear in your family a lot. And what you'll learn later on is some of these things are also connected to high creativity. This is why we see families with a lot of maybe artists and musicians, generations of very creative people. Sometimes you'll also see that they suffered from some disorders like depression or bipolar disorder or schizophrenia because genetically some of these things are linked. So it could be a genetic thing, biological. But origins, what about it was something that happened? Lead paint. Lead was commonly used in paint up until probably the early 70s, late 60s. And children chew on everything. It can lead to developmental disabilities. A lot of older buildings in every major city in the United States and even in Europe had lead paint. And most cities are pretty old. There's a high percentage of people in the Northeast cities who are likely to have developmental disabilities until they discovered that the lead paint was the issue. Another example, origins. 80% of autism spectrum issues are caused by genetic mutations that are inherited from family. And this could be something that's never shown up in your family ever. But the combination of a mother and a father and their genetics together can cause a recessive trait that never showed up before to be matched with another recessive trait, and then all of a sudden exhibit a disorder that was in the genetics of each parent but didn't show up yet because you needed the recessive traits. So, this is why sometimes you see in families a lot of a certain disorder, and sometimes you see, I would say, examples of it. Later on, we'll talk more about genetics because some disorders tend to be recessive, meaning you need each parent to have a certain amount of mutations in their chromosomes, certain alleles, which means that you may not really see the disorder. There has to be a certain combination. But then some disorders we'll learn are autosomal dominant, which means that people in the next generation are definitely going to have a high probability of inheriting this disorder. And we'll talk more about that later. So, causes: what happened to trigger something? What event or situation may have contributed? When was it first noticed? Is it neurological, psychological? Could be both. And again, I used schizophrenia and depression here as examples of like origins of something, maybe genetic. Now, as causes. Schizophrenia is most often noticed around the beginning of college. Now, schizophrenia is a term for break from reality. It's not multiple personality disorder. That's called dissociative identity disorder and is very rare, although movies like to make a lot out of it. If you've ever seen Fight Club or the movie Split, that's dissociative identity disorder. Schizophrenia is a break with reality. You hear and see things that are not there but are very, very real to you. And it's a spectrum disorder, which means that you can have a mild case of it and you can have a moderate or severe case. And we know that medication is the primary way to treat this. Um, there's a movie with Jamie Foxx called The Soloist, which is based on a true story. A musician student from Juilliard who starts developing schizophrenia as a first year college student. And we notice that that's when it begins, but it doesn't mean college caused it. Basically, the average age of onset is 16 to 25 for men and 20 to 30 for women, although 21 seems to be the time period where you may see some red flags. Early signs in childhood can be investigated, but often in childhood you would miss those signs. So, what triggered it? Perhaps puberty, perhaps the physiological state of reaching adulthood could be a cause. Let's use lead paint that caused developmental disabilities here as a cause. Lead paint causes toxic brain damage. So, young children chewing on things like window ledges, which was pretty common, the brain is developing very quickly in early childhood, rapidly. So, the learning differences were noticed about 2 or 3 years of age, because that's when children usually stop chewing on things, and that's when you would notice when they were more interactive in their play and in their speech and mixing with other children of the same age. And you may then notice, why is my child not reaching the same benchmarks as my neighbor's child? And so it was noticed at that time period. Autism again now is a spectrum disorder, and there's many different ways to look at it. You can have a mild autism spectrum disorder and no one notices. It can be moderate, it can be severe. But what we do know is that it's more or less a difference than it is a disability. And if found and noticed early, there's so many different ways that we can help people develop skills that will make their lives easier to navigate. Not to change them, but to make things easier to navigate. So, for example, we now screen autism in pediatric screenings with infants, which we never did before. So, most autism was usually caught maybe around the age 4 or 5, because that's when kids start going to school. But if we can find it when they're 2 or 3, it's after they receive their vaccinations, we started noticing things. And then all of a sudden now we're saying vaccinations cause autism. But that's a correlation, not a causation. It's just when it was noticed. At the same time, the vaccinations stopped. So many people feel very strongly that vaccinations have a lot to do with autism. My thinking is, and again, you can always disagree, is that autism was noticed when children were 2 or 3 because they're starting pre-K and interacting with others. You can notice their differences in behavior. If they have older siblings, you start to notice around this age. If they're not really babies anymore, the behaviors. Um, and it just sort of coincides with the end of the vaccination period. So people assume, okay, that caused it. It's just when it was noticed. Again, you can disagree if you wish. Absolutely always open to disagreement and discussion. So, results. How is this impacting their life? How can we treat it? Do we use therapy? What works best for individual issues? Is medication effective in disorder? And this is where we look at how we help people. And these are real life examples. For example, schizophrenia and depression respond very well to medication because they're neurological disorders. It's all about brain chemistry. Something went awry in your brain chemistry. Now, your brain is growing rapidly, especially through adolescence, and changing. And sometimes the way neurotransmitters are transmitted Something happens, so not enough of the chemical you need in your brain to make you feel at ease or not anxious or not sad. You're not getting enough of it. It isn't that you need more given to you as medication. You need a medication that allows your brain to function the way it did before things sort of went into a little glitch. And that is what medication does in treating disorders, psychological disorders. But we'll really go into depth in that. But for schizophrenia, therapy wouldn't work. There's a whole paranoia aspect to schizophrenia, a distrust. So a person who distrusts their therapist and family isn't going to go to therapy and believe them. Medication is very helpful because they can see reality all of a sudden when before their reality was just very skewed. Um, Depression can also respond to therapy, but first line usually we try to look at neurologically. Okay, lead paint causing children to be developmentally disabled. How was that handled? They got rid of lead paint after 1960 in U.S. buildings. It was removed. It was a very complicated, complex, long process of old buildings um, being looked at for lead paint and having it remediated. Even in pediatric exams in young infants, you have to fill out information about the kind of environment you live in, and your building can be checked for lead paint. There probably are buildings still existing today with lead paint and something to be aware of. If you live in a house with very old wallpaper, like from the 1940s, anything prior to 1960, there's probably lead underneath your wallpaper. So if you were to take it down, you'd be exposing and aerosolizing the lead in the air. So it is still out there, but when they discovered that it was causing children to have developmental delays, they no longer made paint that had lead in it, but you still sort of have to be careful in some areas, especially in older homes that haven't been renovated. Okay, autism can be noticed in infancy and other atypical movements, reactions, and play habits. Instead of playing with the child, they'll play next to them. Although that's pretty common until age 3 anyway. They may like to line up objects rather than play with them. They enjoy patterns more so than other toys. They may seem to have sort of a focus on trains or just dinosaurs or just cars to the point where it seems almost obsessive. If it's just something they enjoy, that's one thing, but you would definitely notice the difference if it was an atypical kind of behavior. If you treat it with early intervention and different types of therapy, again, you can create a sort of map to navigate society. The next thing is what is applied psychology? Little dog is saying, actually, I'm fine. I just like to have a place where I'm allowed on the couch. I thought that was cute. Applied psychologists take all the research and apply it to people. That's what you usually think of when you think about psychology. You apply it. You treat, talk, diagnose, prescribe, counsel. You use the stuff the research psychologists gave us. They make direct use of research, apply it to clients, and seek solutions using that. And that's what focus will primarily be on in this course. There's multiple types of therapies. The goal is to find the right one to treat the specific issue. And we're going to learn about the basic 7 approaches later on in this course. Some work for one disorder but not for another. Some work for one person, but another approach is better for someone else. Everyone is an individual, everyone is unique. Everyone's brain chemistry is a little bit different, which is why some medication will work for someone and it won't work for someone else, but if you switch it, it will, because everyone is different. So you have to find the right approach and also the right person or practitioner, someone that works well with you. There's multiple types of approaches in psychology, and they have changed a great deal since the early days. So, what are the goals of psychology? Describe, predict, understand, and influence maladaptive behavior, things that don't allow for a functional life. So, I remember it as DPUI: describe, predict, understand, and influence. I sort of made up a little thing in my head and said, don't peak until it's your birthday, Christmas, Hanukkah, etc. Don't peak until it's DPUI. That's how I remembered it. It's a mnemonic device. We use a lot of them in here. So basically, you can remember describe the behavior, what is happening, predict if it returns, is triggered by something, understand, research the disorder in detail, And influence means help, change, treat, create a solution, relief from the issue. So that's all that describe, predict, understand, and influence means. You can't treat something you don't understand. You can't understand something if it doesn't have predictable triggers or situations that triggered it. And if you don't know what the problem is, you can't describe it, you can't treat it. So all these things go together. Here is an example. Someone grows up in an alcoholic home. When they are older and have problems, they also turn to what they saw as a child and drink to not feel bad or sad anymore. So, we're describing alcoholism addiction. Could be genetic. There really is a genetic predisposition to addiction in many ways. Doesn't mean that you will be, but it can be in there. Environment. If you're surrounded in an environment where this is your normal and you see this as a way of coping, that may be how you learn to cope as well. It may be a cultural thing where everything is celebrated, or if you're sad, everything is sort of equated with alcohol. And in which case, that's how you grow up and believe as well. Predict. Difficult feelings cause drinking. Drinking causes bad choices. Bad choices increase bad feelings, and bad feelings cause more drinking. See what I'm getting here? That's a cycle. So the bad feelings just cause more drinking, more bad feelings, more bad choices, and it goes on and on and on. It's a prediction of what happens with alcoholism. Understand, this is a complicated disease with many causes and self-improvement treatments, so you have to learn the background of your client so you understand their unique situation. Because everybody, again, comes from someplace different. And influence help them. Cognitive behavioral therapy is what we really use in AA, Alcoholics Anonymous. It changes thoughts, change behavior. And we'll talk more about that in depth later. Group therapy is very helpful with addiction because it creates a team that understands and supports each other and you don't feel alone. It's not just you. And then if you feel weakness and you're going to go to that drink or that drug, you have someone you can call just have to talk to that understands that can say, listen, I'll meet you for coffee and we'll talk about it. Or let's text on the phone instead. So it provides not just therapy, but a support network. Dialectical behavioral therapy, which we'll learn later, is a lot like this. Thoughts change behaviors. Dialectical behavioral therapy creates skills on top of that that the client can apply to their own lives, like a map they can take with them in the future to control their own lives. We'll get into that later. So, what is psychology and why do we use the word maladaptive? There's Maleficent, right? Well, abnormal is a term we use in psychology to describe the most serious psychological disorders and disease, and it is an entirely separate area of study. We talk about schizophrenia, we talk about borderline personality disorder, we talk about psychopathy, and we talk about post traumatic stress disorder, obsessive compulsive disorder. Now, you can have obsessive compulsive traits, but that doesn't mean you have obsessive compulsive disorder. So, abnormal psych is an area in psychology where these are very, very bad patterns that really get in the way of life and need serious intervention. So we don't use the word abnormal when things are just sort of a little off. We use the word for, things aren't really adjustable. Because mal is Latin for bad. See all these bad things? Adapt means to change. If you can't adapt to life situations, you've got to find tools to help allow good adapting behaviors. All of us have adapting behaviors. Some are good, some are bad. It's hard to change the bad ones, but we can work on that together. But first, you have to recognize them. So, maladaptive describes a wider range of actions, thoughts, and behaviors that stop us from being happy and functional and having successful lives and relationships. And it can be mild to moderate to serious. It's common to everyone, just at what extreme and where you learned it. So, what is psychology? The difference between types of providers. Now, there's many areas in psychology. I only chose a few. Psychiatrists are doctors. They have to go to medical school and they do their residency in psychiatry. Some neurologists, doctors who treat the brain and nervous system, usually your central nervous system, which is your brain and spinal cord, or your peripheral nervous system, which are the nerves that branch out from your spinal cord and your arms and legs. There's also your and parasympathetic nervous systems that have a lot to do with your organs and how they function. But for the sake of psychology, we're just going to talk about central nervous system, your brain and spinal cord, and a little bit about your peripheral nervous system, which are the nerves in your arms and legs. Okay? They have to do both residencies and help patients in both specialties. You can see a psychiatrist for emotional disorders, psychological disorders. You see a neurologist for neurological disorders, which can also be a stroke. Actually, Tourette's syndrome, even ADHD, is sometimes treated by neurologists rather than psychiatrists because it's a neurological disorder. Psychologists, they need a PhD or what's known as a PsyD, which means more college after your master's. It's a long haul. But you can work in a hospital setting, you can have your own practice, you can work in settings with a psychiatrist on staff. And in New York State, a psychologist, even with a PhD or PsyD, cannot prescribe medication. They must have a psychiatrist on staff to do that. They can suggest it, but they can't prescribe it. However, psychiatric nurse practitioners and psychiatric physician assistants can diagnose and prescribe medication. So this is a wide growing field. This field is really growing because it's less school, it's a great salary, it's a lot of responsibility, but not only can you treat patients and diagnose, you can prescribe without having to seek a psychiatrist who agrees with your diagnosis because you can have your own practice as well. Social workers provide counseling and refer patients for more intensive treatment or to someone who can prescribe medication. Social workers are really hard workers, and you do provide counseling. We see a lot of social workers in the area of addiction, and there's different levels of social work we can talk about. And I have a video where there's a day in the life of a social worker. You might like that. Um, they need at least a master's level and certification courses. They can work in schools, institutions, the government. School psychologists, they do educational testing and counseling for emotional behavioral issues. In the elementary school, you'll see them doing more behavioral issues and having therapy. In middle and high school, they do a lot of testing for special education purposes and for learning. They have a lot of training in developmental psychology and how children learn. However, school psychologists is a large focus on testing and learning. And if you're not interested in that and you just want to do therapy, it might be something to investigate whether or not that's a good fit for you. Forensic psychologists, they combine psychology and the legal system. They apply theory and practice to the criminal court and correction system. Must have a very good knowledge about normal psychology. And there's a lot of fans out here for forensic psychologists because it's fascinating and there's CSI shows and such, and we can talk more about that when we're together. The only problem with forensic psychology is if you're looking for that therapeutic relationship with a patient with trust, you're really not going to do that as a forensic psychologist because you're working for the government. You're usually looking as a prosecutor to find a reason that this person has committed crimes. So you're really not going to have that therapeutic relationship. It's a little different. So just to help you out, psychiatrists over here what they do, psychologists over here what they do. However, this they do together. Now, there's some crash course videos. I think I already had you see the first one. Now, these were made by Hank and John Green. If you know John Green from The Fault in Our Stars or the book Paper Towns and others, he started this with his brother, but now he mostly just does movies and books because he became famous. But Hank Green does most of the video performances in Crash Course Psychology, and they help you with stuff, and they're funny. This is a preview. This is not the one you did on Edpuzzle if it works for you. It's what to expect, and it's sort of funny. It's not really introduction to psychology. It's like a preview to it. So that one I recommend you click and watch. And for this unit, I'm going to give you some instructions. Click here to read about types of psychology careers. Also, careers where you would use psychology and types of mental health professions and how much school you need is here. If you're really interested in forensic psychology or science, John Jay College of Criminal Justice is the only college I know that has an undergrad bachelor's degree in forensic science and forensic psychology. Most colleges have you get an undergrad degree in psychology and then a master's in forensic, but John Jay actually is very good and interesting and has a lot of forensic psychology stuff. If you're just interested, becoming a psychiatrist, what it takes, it's a medical degree. This is optional, finding the right therapist. put in your zip code and look them up. If you're experiencing depression and you want to talk to someone, you might want to look for a social worker, somebody with an LSW or an MSW or a CMSW after their name. If you're looking for someone who can prescribe you medication, you're going to need a nurse practitioner, a psychiatric nurse practitioner, or behavioral health center that has a psychiatrist on staff because social workers and psychologists cannot prescribe medication. They can just refer you. And I figure you could try some of these. A day in the life of a school social worker, which I thought was very interesting, and a day in the life of a clinical psychologist. So we're going to stop there for now, and I can record the rest later on, but I think that that's a good place to stop, okay? So congratulations, you just completed your first unit. There'll be a link to a Google Forms assessment that you can take, I think, as many times as you want to get to 100. It's sort of a way to help you learn, not really assess you. They do this in graduate courses online. Hopefully it works. And you can click back and forth between the slides in this lesson to help you with the quiz as well. It's not cheating. I want you to do it. So this is a Check for Understanding quiz link. Hopefully it works more than once. I guess we'll find out once you try it. And after you take the quiz, you return back to the slide and click Next. And congratulations, you've completed Unit 1 and What is Psychology? And then you're ready for Unit 2, Early Psychology, and then we'll play games. I'd like to do that when we have Google Meets. But at this point, we'll return to the intro page, and Unit 1, you're done. And remember, there's a Google Forms quiz at the end of this, and you're free to look back at your notes at any point. So I will talk to you later. Have a great day.